Hi, myself Dr. Atul Haipya. Today I am going to perform otoscopic examination. Is that okay with you?
Okay.
May I know your name and age, please?
My name is Arti and I am 24.
Before starting the procedure, we have to sanitize our hands. I already sanitized my hands. First, I am starting with inspecting the external ear. We have to check if there is any infection, swelling, or any discharges are present. And now I am going to turn on the otoscope, and we have to hold the otoscope like we are holding a pen, and we have to drag the ear pinna like upward and backward. And now I'm placing the otoscope inside the ear canal of the patient, and we have to check if there is any foreign bodies, swelling, redness, or any discharges are present. We can also visualize the eardrum color and contour, and we can also see the handle of the malleus with short process, pars flaccida and pars tensa. And we have to check the other ear also. Thank you.
Good evening, myself Dr. Sarvesh Bhattacharya. So today I'll be performing two tuning fork tests on you. Is that okay?
Yes, sir.
Okay, so the first test is for the lateralization, which is Weber's test. So can you tell me on which side is the sound clearer, left, right or middle?
Middle.
Okay. Now I'll be performing a test for conduction, which is Rene's test. So first I'll place the tuning fork behind your ears, and once you stop listening the sound, just let me know.
No.
Did you hear the vibrations?
Yes.
Okay. So now just perform the same test for the other ear also. Thank you.
I'm going to perform a nose examination. Now I'm inspecting anterior and inferior surfaces of the nose. Now I'm inspecting nasal vestibules with pen light. Now I'm inspecting inside area with an otoscope. Now I'm going to discard the specula which I used for the examination. Now I'm palpating the frontal and maxillary sinuses. Nose examination is done. Thank you.
Hello, I'm Baby David Singh Arvind Marino. I'm going to examine the oral cavity. What is your name and your age?
Ent 23.
Okay, I'm going to examine your oral cavity. Is that okay with you?
Okay.
Firstly, I'll be examining the lips of the patient. I'm looking for any discoloration, any swelling, or any bleeds, any bleeding. Please open your mouth. Can I see your teeth? Say. Okay. I'm going to I'm going to look for any cavity or any decay or any bleeding in the gums. See. Okay. Can you put your tongue outside? Okay. Now move your tongue to the right side. Okay. Move your tongue to the left side. Put your tongue outside. Okay. I'm going to look for any masses. Okay. It's completely normal. Nextly, I'm going to examine the retromolar, the hard palate and the soft palate. Put your tongue out. Put your tongue out. Say ah. With the help of the tongue depressor, I will look for any tonsillitis. Your ovula is in the midline and symmetrical. We'll check for any ulceration and any white patches. I will check for the soft palate and the hot palate. Lift your tongue. Lift your tongue. I will check the floor of the tongue. Lift your tongue. Okay. I will use my finger to check and feel the submandibular. Okay. Okay. The oral cavity examination is done. As per the oral cavity examination, your oral cavity seems to be completely normal.
Thank you.
Hello, I'm Dr. Arti Balakrishnan. May I know your name and age, please?
Haripriya, 23 years.
Okay, now I'm going to perform the tongue examination. Is that okay for you?
Okay.
Okay, now I'm going to check for the anterior surface of the tongue. Can you please open your mouth and stick your tongue out? There is no tenderness. Now I'm going to check for the gag reflex. Can you please open your mouth and stick your tongue out? Now I'm going to check for the oral mucosa to look for any lesions. Can you please open your mouth and stick it? There is no lesions. Thank you for the cooperation. Thank you.
Hello, how are you?
I'm fine.
What's your name?
I'm Zahid.
Can I examine your neck?
Yes.
Now first inspect the symmetry of the neck and note any mass if there is any. Now we will inspect the lymph nodes. We will use the pads of index and middle finger of the both hands, and then first we will inspect the pre-auricular nodes, then posterior auricular, then occipital, then tonsillar, then submandibular, and then mental, then superficial cervical lymph nodes, then posterior cervical lymph nodes, then deep cervical lymph nodes, and then supraclavicular lymph nodes. Now we will inspect the trachea for symmetry, and then we will palpate the trachea with the finger on the trachea, the index finger on the trachea, and then we will see the distance between the trachea and sternocleidomastoid muscles on both sides. Now we will auscultate the trachea to check the breath sounds over it. Now we will inspect the thyroid gland while the patient is swallowing the water. Can you take a sip of water? Can you please swallow the water? While the patient was swallowing the water, we can see the upward movement of thyroid cartilage, cricoid cartilage, and thyroid gland itself. Can you please flex your head a little bit? Okay. So now can you take a sip of water? Just like previously. Can you swallow it now? I can feel the isthmus of the thyroid gland when the patient swallowed the water. So now to palpate the lateral lobe of thyroid gland, I will press the thyroid gland from left side to the right side, and from the right side I can palpate the right lateral lobe of the thyroid gland. And now I will press from right side the thyroid gland toward the left side, and from the left fingers I can palpate the lateral lobe of the left side.